Peritoneal mesothelioma is a rare and aggressive form of cancer that affects the peritoneum, the thin layer of tissue that lines the abdomen and covers most of the organs in the abdominal cavity. It is primarily caused by exposure to asbestos, a naturally occurring mineral that was commonly used in various industries until its health risks became known. In this article, we will explore peritoneal mesothelioma in detail, including its causes, symptoms, diagnosis, treatment options, and prognosis. 1. Causes and risk factors. As mentioned, asbestos exposure is the leading cause of peritoneal mesothelioma. Individuals who worked in industries such as construction, shipbuilding, mining, and manufacturing are at the highest risk of exposure. Additionally, secondary exposure can occur when asbestos fibers are brought home on clothing, leading to exposure for family members. 2. Symptoms. The symptoms of peritoneal mesothelioma can be nonspecific and may resemble those of other abdominal conditions, making diagnosis difficult. Common symptoms include abdominal pain or swelling, nausea, vomiting, unexplained weight loss, bowel changes, and fatigue. Because these symptoms can mimic those of less serious conditions, patients often experience delays in diagnosis. 3. Diagnosis. Diagnosing peritoneal mesothelioma typically involves a combination of imaging tests, such as CT scans and MRIs, along with biopsies to confirm the presence of mesothelioma cells. A thorough medical history, including any history of asbestos exposure, is essential for accurate diagnosis. Additionally, blood tests may be conducted to assess levels of specific biomarkers associated with mesothelioma. 4. Stage and other forms of cancer. Peritoneal mesothelioma is staged to determine the extent of the disease and guide treatment decisions. Staging may involve imaging studies, such as CT scans and PET scans, as well as surgical exploration to assess tumor spread. The most commonly used staging system for peritoneal mesothelioma is the TNM system, which evaluates tumor size, lymph node involvement, and the presence of metastasis. 5. Treatment options. Treatment for peritoneal mesothelioma often involves a multimodal approach, combining surgery, chemotherapy, and sometimes radiation therapy. The goal of treatment is to remove or shrink tumors, alleviate symptoms, and improve overall quality of life. The most common surgical procedure for peritoneal mesothelioma is cytoreductive surgery (CRS), followed by hyperthermic intraperitoneal chemotherapy (HIPEC), which involves delivering heated chemotherapy directly into the abdominal cavity to kill remaining cancer cells. 6. Prognosis. The prognosis for peritoneal mesothelioma varies depending on several factors, including the stage of the disease, the patient's overall health, and the effectiveness of treatment. Generally, peritoneal mesothelioma has a poorer prognosis compared to other forms of mesothelioma. Hello everyone. Today we are going to talk about a very serious and life-threatening disease, mesothelioma. Mesothelioma is a cancer that occurs when the mesothelial cells, which cover the lungs, heart, liver, and abdominal walls, become damaged or transformed. These cells are responsible for regulating fluid balance and protecting the body from infection. The primary cause of mesothelioma is exposure to asbestos, a mineral that is commonly used in building materials, insulation, and flooring. Over the years, asbestos has been linked to several diseases, including mesothelioma. The estimated number of cases of mesothelioma diagnosed in the United States alone, around 7,000 each year. Mesothelioma can present itself in various ways, and the symptoms may not be apparent at the early stages. The classic symptoms include difficulty breathing, chest pain, and weight loss. As the disease progresses, other symptoms may include abdominal pain, fluid retention, and, in some cases, bone pain. A small percentage of patients may not exhibit any symptoms at all. The prognosis for mesothelioma is extremely poor, with an average survival rate of around 12 months from the time of diagnosis. The disease is usually diagnosed at an advanced stage, and most patients are not suitable for surgical or radiation treatment. Unfortunately, there is no cure for mesothelioma, and the only treatments available are palliative. The goal of treatment is to manage symptoms, improve quality of life, and extend life as long as possible. The prognosis for mesothelioma depends on the stage of the disease at the time of diagnosis. In conclusion, mesothelioma is a rare and aggressive cancer that is primarily caused by exposure to asbestos. While there is no cure for mesothelioma, early detection and appropriate treatments can help manage symptoms and improve the quality of life for patients. We must remain aware of the risks associated with asbestos and take every precaution to protect ourselves and our loved ones from this deadly disease.